Hello, everyone, in the new episode of Innovation Plus. Today, we are recording a very special episode in the office of iRegained. And we have total five people from the iRegained team. Four people from the iRegained team. Fifth one is myself. And yeah, we are going to have amazing conversation today. So let me just start by introducing the team members. And I'd like to begin with introducing Dr. Vineet Johnson. So, Dr. Johnson is a pioneer leader in neuro rehabilitation and medical technology. His journey combines extensive academic expertise with a dedication to improving lives through innovation solutions. He holds master degree in neuroscience from Simon Fraser University, 2003, and a PhD in neuro rehabilitation from McGill University from 2013. As an influential instructor at Simon Fraser, Concordia, McGill, and Capilano University, Dr. Johnson has mentored future healthcare professionals. In December 2016, he founded iRegained, serving as a founder and president and CEO. Under his leadership, iRegained developed the MyHand System, a groundbreaking solution that restores hand function for stroke and traumatic brain injury survivors through neuroplasticity, offering hope and independence to millions worldwide. Today we explore Dr. Johnson's inspiring journey, the science behind MyHand, and his vision for neuro rehabilitation. Thank you so much for being with us, Dr. Johnson, and I welcome you in the podcast.
Pleasure to be here. Thanks a lot for bringing us on board.
Thank you so much. And I'd like to introduce one more special guest we have today. Is a dedicated leader in clinical operations and neuro rehabilitation technology, Eric. Eric Dumais. Yeah. Eric holds a Bachelor's of Science in Kinesiology and Exercise Science from Laurentian University, and he's earned certificates in Disruptive Innovation and Technology Leadership from Harvard Business School. As a Deputy Director of Clinical Operations at iRegained, Eric oversees development and implementation of the MyHand System, a groundbreaking digital neuropathic solution that restores hand function for stroke and traumatic brain injury survivors. Today we delve into Eric's impactful work and we'll explore more in the podcast. Thank you so much, Eric, for being here with us. I welcome you in the podcast.
Thank you very much, Mahir. And I'd also like to take the chance to introduce two other colleagues of mine, if that's okay with you, who are joining us today. Sure. We have Mr. Laurentian Hickey, who's the head of gamification and game implementation in the MyHand System, and my good colleague Margot Shima, who's the one of our head clinical researchers at the company.
Yeah, thank you so much, Margot and Laurentian, for being with us today, and I welcome you in the podcast.
Thank you.
So let's begin with the podcast. I have a set of questions that I would like to begin with. And by the way, for our viewers, this podcast is going to be slightly scientific, but you are going to get a lot of insights about health tech and the students who are studying currently at kinesiology in Laurentian might get some benefit from the podcast. People who are interested in neuroscience will also, it is going to be insightful podcast for you as well. And so let's dive into the question that we have. So let's begin with the founding story and inspiration. So I'd like to direct this question to Vineet. Can you please share the story behind founding iRegained and what inspired you to develop MyHand System?
Thank you. There are lots of reasons why this company was started. I'll give a lame reason first. Today, if you go stand outside in the middle of nowhere and you order a pizza, there'll be like 100 different companies that will bring a pizza over to you. But if someone is disabled and they want specialized hand rehab care, there's no solution out there. There's a huge disparity here that we kind of largely ignore this particular space. And it's very impactful because when people are able to use their hands, they're independent, number one. They could do their own toileting, put on their own clothes, cook their own food, buy their own groceries, and so on and so forth. If not, they're dependent on someone. Second, if you cannot do all those things, you do not have dignity. Somebody else has to help you every step of the way. Third, and most important, the word quality of life. If quality of life doesn't exist, then you lead a pretty poor standard of living, regardless of who they are. Because stroke doesn't pick people based on a particular segment. It could hit the rich and poor the same, men and women the same, and across the spectrum. Let me go to the personal reason. This is a philosophical reason why we start. A personal reason, 30 plus years ago, I was an undergrad student in India, in southern India, called Christian Medical College. And one of our professors who taught neuroscience, he walked into this classroom and he gives this fantastic lecture. Till that day, I knew the word brain, but I had no clue the word neuroscience. I knew neurosurgery and things like that, but didn't know the word neuroscience, right? And I was just fascinated because his entire talk was focused on what is the brain, what is the body, and how does that brain control that body? And I was just fascinated the fact that you've got this thing up here that I thought I had one, and I had no idea what it did and how it controlled. So at the end of the lecture, I walked up to him and I said, could I come and volunteer in your lab, research assistant, whatever the position? And he's like, well, people like you don't have the time. You're just too busy partying and doing all this silly stuff in university. And I said, yeah, despite that, you tell me when, where, I'll be there. So he said, tonight, 10 p.m. So I said, sure. So I turned up
in the lab, 10 p.m. Okay.
Because all the animal research, surgeries and stuff, they do it in the night.
Okay.
For a myriad of reasons. And I walk in and they have this monkey tied up. They put a little hole in the brain, they took out a piece of skull, stuck a needle into the brain, and it gives a tiny little current, and the first finger just starts to twitch. I was just fascinated as to how meticulously you could control. Because I never thought that was possible. I didn't even know a concept like that existed till that day. And ever since, I've been addicted to this whole concept of neuroscience and control. So if you just look around the room, everybody's sitting differently. If you look around, each person holding a pen and trying to write, they all hold and write differently. If you look at people walking, they all walk differently. And the reason why we all do things differently, it's based on your brain understanding what your abilities and capabilities are, and comes up with a formula like an algorithm, and meticulously controls what we do. We all think we control, but it's our brain controlling the whole machinery of what happens. So when you look at the hand, for example, you've got from here to here about 25 joints, 35 muscles. It doesn't matter what you pick up, whether it's a business card or a sack of potatoes. All 35 muscles have to fire. And the ability to control to that nitty-gritty. If one muscle makes a mistake, and the whole function is gone. That's how meticulous that control is. And as I was getting addicted to this whole concept of understanding control, I was also, by then I was qualified as a physical therapist, I'm trying to understand what happens when part of the brain is lost. Stroke, brain injury, right? War veterans. That whole software that they accumulated information over their lifetime by learning different tasks is all wiped off overnight. Suddenly, that part of the brain is kind of like your hard drive in your computer, is wiped clean, and there's no communication going to the hand. So there's nothing wrong with your hand, but the communication from the brain is not coming. So then we started looking at strategies to understand how do you put those control back? How do you reinstall the software? Lack of a better word. And that's a whole wide body of science that focuses on understanding how does the brain work? What happens to the damaged area? How do you, if that is damaged, how do you educate the areas around the damaged area? How do you take all the sensation from your hand and send to the brain to trigger those alterations? Or how do you control the muscles? So you want to address each of these from the neuroscience side, fundamental neuroscience side, from the physical therapy, occupational therapy, the rehabilitation side, and also provide a device that has an engineering that a patient can collaborate with, no matter how bad their disability is, how bad their hand function is. They should be able to use it. And then comes the software side of things. You want all the software in the device to be clinician friendly, patient friendly, so on. Then comes the designing side of it. And the design side, you got to design the device in such a way that the patient doesn't go to the device goes to the patient. They're serving the patient, not the other way around. So it was designed with that focus. And then you needed business professionals, marketing, sales. So we put together meticulously, step by step, each of these professionals, which we proudly call the team iRegained's. So that's
the story.
Lack of a better word in a nutshell, but it wasn't really a nutshell. But that kind of gives you an overview of what we've done today.
Yeah, amazing. This was very inspirational, actually.
And I must want to add, today in particular, today's date is 17th of September, a very special day for iRegained, because our first device got shipped out to our first client.
Oh, wow. And that client is in which country? Is it Canada?
Let's just say first client for now.
Okay.
We don't want to discriminate between clients. They're all our clients.
Okay.
Regardless of which part of the world
Right,
they're
right,
in.
right.
We don't want to pick sides on anything.
Right, right.
We're here to serve people with disabilities.
I was just curious because I think in one of the event where we were there, you mentioned you travel a lot in the US. So I was maybe later in the podcast we might be able to cover that because it's
Yeah, it's not just the US. We travel a lot
everywhere. Yeah, because like the technology that you just mentioned, it's fascinating, and I also I was curious about the reach of the tools that you have developed and constantly improvising. New and new models keeps coming, and so maybe later in the podcast we will also cover which part of the world that iRegained has presence, and where potentially you are expanding, because this is life. It's amazing.
You said it well, life changing.
Yeah, life changing technology, and I think it should reach in maximum areas, parts of the world, and maximum people should get benefit out of it. So very, very inspirational. Now let's move on to the next topic of this podcast, where we dive deep into the science behind the neuroplasticity. And this is very new for me. This word, I'm just trying to understand what it is, and for all the viewers, I think many of you might have heard this for the first time in your life. So let's learn something about neuroplasticity from Eric. So maybe Eric, would you like to just explain us like how the MyHand system leverages this concept, and what is the science behind it?
So, we'll stay off the science a little bit and focus on more like practical uses of neuroplasticity. So, if you were to tell me, you know how to ride a bike, for example, how did you learn how to ride a bike?
By attempting it. Like I saw everybody, and then I was just following what they were doing. I fell a couple of times, and like eventually I just got a rhythm.
Yeah, exactly. So neuroplasticity is your ability to learn something. Whether it's, and Vineet, correct me if I'm wrong, you're the expert, but it's generally just being able to reorganize your brain to perform a task, whether it's mental or physical, more effectively over time. So the more that you practice, the better that you get at it. And the way that this works is that there's a signal that comes out of your brain to your muscles to do something. And then your muscles do something, and there's a signal that goes back up and said, okay, this is what I did. And there's a part of your brain called the cerebellum that kind of counterchecks these and makes sure that the signal you sent down was what you did. And if there's just the slightest little variation in what you wanted to do, or your brain expected you to do, and what you actually did, it sends a signal and says, that was wrong, do it again. And that's how you learn to ride a bike, right? You do it over and over again. First you do training wheels on, then you take the training wheels off, and you do it over and over again until one day it just clicks. So that's all good and well for people like you and I who have not had a stroke or a brain injury, but then the question comes when, what happens when you can no longer control your body the way that you want to? So one thing that Vineet said earlier is that you use the parts of your brain, right? There's a lot of brain dedicated to the hand. So if you take the brain real estate in the motor cortex, so how much of your brain is dedicated to each body part, there's about 33% dedicated to your face for talking, moving your lips, moving your eyes, another 33% dedicated to your hands, and the last 33% dedicated to the rest of your body. So in your body's motor representation of your body, or your brain's representation of your body, your hands are very, very important. And there's a lot of different sensors there. There's a lot of different muscles that are needed to do tasks of daily living, from playing with the cups that I'm playing with right now to writing your name or typing or texting or getting dressed or drinking coffee. And when that part of your brain is damaged, you can no longer use your hands. You have to use different parts to kind of take over that task. There's a cool study that I was thinking about while Vineet was talking, where they found out that if you have brain cells that are of similar size, structure, and function to the ones that you have lost, those will begin to take over the task. And this is a study that I read a couple weeks ago, where they had a mouse and they made the mouse deaf. So they restricted the stimulus going into the hearing portion of the mouse's brain, and then they somehow anatomically rewired it to become the motor matrix, or the motor cortex of this mouse. And even though it wasn't originally supposed to be that, the mouse was able to learn to walk and navigate mazes and drink and eat using a completely different part of the brain, because it has a similar cellular structure to the motor cortex. Wow. which is pretty cool. So we're not rewiring people's brains that way, but we are providing an environment for them within which they can practice and use the parts of their damaged brain that are surrounding the infarct, or the part of the brain that's dead, to perform these tasks again. So for example, if you have the part of your brain that can't move your ring finger anymore, the other parts that control your middle finger, your pinky finger, muscles in your palm will kind of take over and take some of the load off of that damaged part, so they can relearn how to do it. And the same way you learn how to ride a bike, you can relearn how to use your fingers. And when it comes specifically to the MyHand, you need an environment within which you can repeatedly do the same task over and over again. When you learn how to ride a bike, I'm guessing you did it because all your friends around you are riding a bike, or you wanted to ride with your dad, or in my case, my uncle used to take me in a little trailer with my brothers, and I wanted to bring my brothers in the trailer so we can go to the corner store and get candy without having to talk to mom and dad, or without having to bring us, right? So essentially, it's just, if you have an environment that you enjoy doing the practice in, it makes it all that much better. And traditionally, when you think of hand rehabilitation, they use little toys and stuff that are not very rewarding, and oftentimes, in a lot of cases, they're children's toys. So sometimes that can be belittling to some people, like, I'm just playing with toys, like, how is this making me any better? Well, here you go. This is a machine that's dedicated to make your hand function better, and there are games to which you can get definitely addicted. I don't know how much you do Wordle, but we have a word game. I do Wordle every day, and you can play your word game with new words every day, every hour, that they can solve puzzles. They can play action games depending on what their preferences are, and we have interactive interfaces that will use the patient's own data to create a tailored and specific exercise prescription, so they know that they're doing the work that they need to. When we get into this conversation about personalized medicine and unique from person to person, that's exactly what we do. We take their finger movement data and we prescribe a specific and unique prescription for each and every person that uses the device.
That's amazing. I think this was very interesting when you mentioned about taking this psychological thing like addiction and the adrenal rush, because that really helps anybody to to reach towards where they want to go. Like, if you see somebody who's doing karate, and if you find it cool, and if you want to become like that, you'll put all your effort, your mind, your body, and everything towards becoming like that. And that feeling that drives you very well. So I think an addiction as well, like that also helps.
That's what we want to do. We want to create an addiction to rehabilitation, and we're maybe not super right now, but people enjoy our games, and it gives me a lot of pride to say that we've created a product that people like to use and that thankfully have success using. You know, we have some life-changing stories that come out of iRegained that I've been very proud to be a part of, and this is, you know, an excellent way for me to start my career off in rehabilitation. It's been quite the journey these past four and a half years.
Amazing. So this was the little bit of science and background behind the MyHand journey. Before moving into the next topic, I just wanted to maybe ask one question to Vineet, just because you mentioned about, you know, the rewiring of the mind and everything. So nowadays, you know, the large language LLMs are very popular nowadays, and I myself have been, you know, leveraging that a lot, and have been into building custom agents and using it in a lot of different ways.
I guess your recording stopped.
No, it's on.
It's on, so?
Oh, no,
Okay.
there's a pop in the middle. In the center of the screen, there's a pop-up.
Oh,
Oh,
You want to do the profile?
yeah, just close the app and restart.
okay.
I guess you do have to do some editing.
Oh, it's in slow-mo on video.
Oh,
We'll edit that. We'll edit
Yeah,
that.
yeah.
No
That's
worries.
okay, that's okay.
Okay. Oops.
you can speed up the video.
Yeah,
Yeah.
we'll fix that. We'll fix that. No
So
worries.
click go.
Video?
Yeah.
Alright.
I think it's again a slow mo or
No, I think that's good.
fine. Okay.
Wait, move feet.
Oh, probably the device wanted me to shut me out because
Yeah.
it's too loud.
We'll just see your mouth.
Just
move
slow mo.
really
Yeah.
slow.
iPhone storage full.
Uh-oh.
Okay. No worries. We can use the other phone that I
On
have.
my phone.
No. I have. I'll just put my phone. No worries.
Yep. Are we still adding BL at the bottom? Or I'm assuming it's on the bottom tab?
Yeah, I'd like it to.
Okay. Yeah. So back to where we were. So I was just curious about one thing that I wanted to ask. Vineet. So nowadays the LLM models are very trending, and I'm sure you know you all of you might have used the latest model of ChatGPT and you know explored it. And what interests me a lot is the fine tuning of the model. So sometimes when I want to do a specific task, so I build a lot of APIs out of you know a custom model of GPT, and this is very fascinating to me. When Eric was mentioning about rewiring of the mind, I just wanted to ask: is it possible, maybe today, or if not today, maybe then in the future, to rewire somebody's brain in a way that if you want to train somebody on a specific thing, then there are some scientific methods to you know to train that brain in a way that it helps. It could be possibly, let's say, a horse riding. If you want to train somebody in horse riding even before he starts actually learning horse riding, like, is there any way that we can do it, or maybe in future, or even in today's time?
The first thing is anything is possible once you understand,
Right.
right? The biggest challenge with the brain is if you talk to most neuroscientists that spend all their life, 30, 40 years of their life, dedicating towards understanding basic components of brain and nerves and so on, they'll tell you modern man probably knows less than 5%. And even that 5% is probably exaggerated. A study that came out, it was published, I forget where, it came out of MIT and Google collaboration. So there was this tiny little piece of brain, half the size of a grain of rice, was taken out of somebody's brain to treat epilepsy. And they didn't want to throw that away. Instead, they wanted to look at it in depth, to look at how many synapses it has. Synapses is the connection between one neuron to another neuron, right? And which also tells you how much connections, how much data is stored, so on and so forth. That tiny little piece apparently had some 15 million gigs of data, right? To say eye-opening is an understatement. Because today, everybody talks about AI, and AI is based on chips. Chips is based on recording data. That's the trail there out there, right? So look at the smallest device that can store data. How much can it store? Right?
A couple of terabytes.
Exactly. So here we are talking some 15 million gigs. That kind of gives you an eye opener into what is stored. So going back to training, like what you said, somebody doesn't know how to ride a bike or ride a horse, can we train them before they get on it? One body of research exists, but before the body, I should mention a movie, Matrix. Right? In Matrix, they stick something in the back and upload a software into your brain, and suddenly they know how to fly a chopper, even though they never knew how to do it.
That's what I was
before.
thinking about.
Right? But based on the current neuroscience understanding, obviously Matrix doesn't fit into that logic. But if you go look at existing science, it talks about mental imagery. Mental imagery or mirror neurons. What it is if you want to ride a horse, maybe you watch how somebody else is riding a horse.
Yeah.
Triggers certain parts of the brain.
That also helps.
That's the current advancement that clearly tells you there's probably 20 plus years of neuroscience publications in that area. How much it helps depends on each individual, because our learning capacity is depending on your motivation, your abilities, your inabilities, your wants, your anxieties. There's myriad of issues that determines what you can learn or cannot, what you will learn and will not, right? And also our moods. One day you're excited to do something cool, and the next day you're a little moody, you don't feel like doing it.
Right.
So all of those things will impact. So going back to your question, like ChatGPT, can it actually do? Time will tell.
Yeah, like for example, tech like VR, where in NORCAT where we are sitting, like they have the simulation lab where people, without actually being themselves underground, they experience the environment underground, and then when they go there, they feel very comfortable and they can do the task, better.
Well said. Let me separate that task, what you just now talked about. This is in a situation where you're talking about a human being who walks around healthy control, is what we call it. In the normal world, we'll call it a normal patient, normal individual. So you're giving them an imagination of what it could be.
Right.
Right? But in the world of human movement, it's a different aspect. You're changing the environment, not the movement itself. There was I think 1971 or 2, there was a publication on cats. This is one of those things that allowed humans to understand the power of the sensation and the motor control by the brain. They got a cat to walk on a treadmill. They call it basically a kitten. I think it was a 1 or 2 day old kitten.
Mm-hmm.
So one kitten was walking on a treadmill.
Mm-hmm.
The other kitten was put on a little cradle, so it's moving. In other words, it's actually watching the other cat walking. It also thinks it's moving. And after the training period, they found out that the cat that actually walked can actually walk. The cat that sat on a cradle couldn't stand.
Okay.
Because those receptors were not active. If they're not active, they didn't learn. If they didn't learn, it was meaningless. So there are two different aspects to it.
Right.
So VR created a change in environment, which is great. But you still need the fundamental components. If you add both of that, like think of our device. The device does everything. Currently the device is a semi-immersible VR. If you add a goggle, it becomes a fully immersible VR. So you've got the baseline and the environment, then you've got the perfect mix.
Right.
I think that is very important to add to it.
Yeah, that's a really great insight. So let's quickly move on to the next topic, because we have a lot of topics to cover. Let's talk about product development and innovation. Maybe Laurentian and Margot, if you want to walk us through the journey of the product development and innovation, like from scratch, from where you started and where you are right now.
I think there are many things to cover when we're talking about the development, and perhaps Laurentian will speak on the software side of things. I was talking to the engineers and I was asking them what were some of the main challenges that they had. And I think I can also agree that the big thing here is that none of us here have suffered a stroke or any traumatic brain injury. So we, at the end of the day, didn't know exactly. We have an idea of what they could need or what they need. We have that theory behind, but we don't have the experience. So the challenge was, okay, how can we make the device that will help them exactly, but that will be adaptable to them and accommodate all of their needs. And the engineers will tell you that some of the requirements that the clinical team had were a little bit were very broad and maybe a little bit far-fetched, because we want the best, and so it was adapting and doing all the R&D, so developing one thing and then going, okay, did this work with the patient? So we had volunteer patients come in, test very intensely, came in every week. We had multiple, so different sizes, different ages as well. So the main thing was testing, going back to the drawing board. Okay, this worked, this didn't work, so let's work on what didn't work. This worked well, why did this work well? And also adding a lot of feedback from the volunteer patients and listening.
A lot of retrospect.
Yes, talking to them, asking for feedback. What did they like? What did they not like? How can we make this better? And then going back to the drawing board. Okay, like let's work on this. Let's keep this here, and let's keep moving.
Yeah, a lot of that patient feedback really helped us. That patient feedback really helped us make some of the games more engaging than they otherwise would have been. I'm proud to say that some of the games were just a hit right off the bat, but other ones, like our word game, it was constantly just, our patients would be like, well, I don't understand this, why is it like this? There's like, what am I looking at for this box at the top?
They didn't like it in the beginning.
Yeah, and there's just a lot of visual noise too, stuff like that. The reason for that mainly was because we were trying to what's it called? The game that Amy was trying to replicate.
Whack-a-mole?
No, not Whack-a-mole. It was it called Code? No, it wasn't called
Was it
Codebreaker.
Hangman?
No, it was a Codebreaker thing, but it had another name.
Oh, Mastermind.
Mastermind.
So if anyone knows Mastermind, it has a learning curve for sure, because it tells you if you have the right item, but only if it's in the right position. So then you have to know, is it in the right position? And then it tells you, okay, you got the red dot if it was right in the right position, but then you get a white dot if it was right but in the wrong position, and you get a black dot if it's wrong in both cases. So trying to teach that to patients that are typically elderly is very much a challenge. So you have to kind of simplify a lot of those things and make it intuitive and make it interesting for them. So a lot of that we were still trying to, or at least I was still trying to maintain some of that. And what I realized was that we didn't really need to. What we really needed to do was strip most of that foundation out of it and turn it into something else completely. And what we found was that a lot of the code that I had written for it was better suited for a word game, where instead of trying to find something that's right color or right position and right symbol or whatever it is, that instead we would just do, if you got the right letter, it would populate it into the word search and tell you, okay, you got that letter right and this is where you got it right. And then when you get them all right, it'll tell you, hey, you solved this word. People tend to understand that. Word games are pretty popular, so.
And once they start winning, I think they would like to play it more. And
yeah, because they'll go, oh yeah, I got the word. It took me a couple tries, and then they'll see their time at the top, and they'll go, well, I did it in 2 minutes.
Right.
Let's see if I can do it in less time.
Mm-hmm.
So every aspect of the product development, if you think of it, people come in all kinds of shapes and sizes and
Interest.
levels of disability, interest, different levels of disability, functional problems, stroke, brain injury, cerebral palsy. The device's job is to cater to all of these patients. You can't say I could communicate with this many patients, but not those patients.
Right.
Yeah.
So when you listen to what both of them highlighted, the entire team would highlight this. Every little thing was meticulously understood,
Customized.
customized, personalized, and catered to. That's probably the greatest achievement of Team iRegain, because I could confidently say there's no other device. Use Google, you'll figure it out. There's not a single device out there that can remote insurance or the government provider. They are interested in, should we actually fund these things?
Mm-hmm.
So more data we get, that data they look at the data and they go, okay, based on the past, these guys have worked with this many patients got better. And so there's an advantage for the insurance company. So think of disability insurance. Let's say someone after a stroke lives 10 years or 15 years or whatever. They have to pay disability insurance for that long.
Right.
Now, if that individual is able to gain some level of independence, then the insurance company has a lot to gain. So they're also looking at the data.
Mm-hmm.
So data is key. I'd rather not use the word AI because everybody's using it.
Yeah.
But what we really mean is this:
It has to be
centralized, very, very personalized
Right.
precision medicine, like Eric was pointing out to the patient, diagnostic, prognostic details to the clinician, and data to the insurance company.
Right.
I have to leave in 5 minutes. Just a heads up. I gotta leave in 5.
Okay.
What time's it?
6:15.
Oh, okay.
So like, do you want to add, like, we are just going to cover only mission, vision, and
No,
last thing
we're good,
on
we're
AI.
good.
You're
Just
good.
letting Vineet know so we can
Okay.
get to the last point.
So the last two things that we want to cover is just mission and vision, collaboration. Maybe Margot and Eric can talk about clinical validation.
Yeah, go ahead, Margot.
I think I think there's many aspects to consider in that. What would you like to cover over that?
For the like research patterns and you had any research collaboration that you had or anything, any patterns that were used which contributed in development of the clinical validation of MyHand.
Yeah, we've worked with many hospitals in Canada, and we've worked even across in India and other countries as well. It's been really good to target different populations. We are looking to work with others populations as well. We've worked a lot with stroke population, and we're looking to go with other traumatic brain injury, cerebral palsy, and all of that. And it's helped with putting the device out there, definitely, and also expand our resources and our knowledge on the subject.
Yeah, so just to piggyback on Margot's point, now that have been done over the past little while, and what we're doing right now is gathering data, preparing for publication, and we have published at several different world-leading conferences internationally. A couple abstracts just showing the data off. But what's really been cool about these research collaborations is you get to meet a lot of different people. So, for example, for myself, early career, I meet someone who studies, this part of the brain and that part of the brain, and they get to teach me a lot of different things that I can apply to my day-to-day life. Not day-to-day life, like just living, but more so in the workspace. So teaching me how to write a manuscript or, become more comfortable with the ethics process or grant writing process. So these are skills that Margot and I have acquired through the clinical validation process. And of course, making sure the device works with patients in an official research setting is always good too. But it is an excellent space to be in early career, and it's a great place to launch from afterwards to collect very, very useful skills and learn how to work with utmost professionals in their fields and experts in the leading fields that they're in.
Sounds good. And next, I wanted to cover the regulatory challenges and market entry. How difficult it was to face that, and how difficult it was to have a market entry in Canada and in other parts of the world.
Well, I mean, we're still facing market entry. We just released our first device today. It just left one of our manufacturing shops. But in generally speaking, in terms of getting into the market, there's a lot of different things that you need from a safety perspective and from a regulatory perspective. So here in Canada, you need your MDEL, which is your Health Canada approval. In all jurisdictions that were registered, which is the US, Canada, and in Singapore, we're a class 1 device. So that's the lowest category of, or the highest category, lowest or highest category?
Lowest for risk.
Yeah, lowest for risk. I'm trying to say it's very safe to use.
Okay.
Lowest risk category. So in Canada, there are 3 categories. In the US, I think there are also 3 categories. So the FDA in the US, we registered with the FDA maybe a year and a half, 2 years ago now, and we recently approved got our HSA approval. From one jurisdiction to another, the requirements for approval can vary greatly, but generally speaking, they just want to see that if the device is safe to use, both from a user point and from an electronics point. So they want to make sure that, when you pass by using your cell phone, that it won't fry your cell phone, something like that. It's not like putting your cell phone in a microwave.
Right.
So we had a very successful testing with some lab groups across Canada who tested our device, and we're poised right now to enter the market with a bang. We have our first device going out today. We have several other orders and POs that are in process, and the devices are being delivered momentarily. We have a trade show coming up in the US that we're going to be very present at. And for the future, I think that right now we have too much supply to keep up with, or too much demand to keep up with, which is a very good problem to have, but it also makes it stressful, like who gets what and when. But we're hoping to keep that problem going for the next couple of years.
Yeah, that's good. Like in software development, there are certain regulation. For example, when I was working with a multinational company back in India, for each country we had to be very careful. For example, European Union follows a different standard like GDPR. You might have seen recently Apple had to comply with the European Union's demand for the charging thing. So I feel is it the same in this industry as well, like in Northern America?
We already have a USB-C. So we're good to go.
Okay. Yeah, that's good. Like in terms of expanding, I'm guessing it might be easier for you guys to expand in US as compared to either Europe or Asian countries or African countries, or
I mean, generally speaking, the device is very, very safe to use, both from a user and electronic standpoint. So there's no worry, really. For us, it's just where do we want to concentrate our resources, right? Europe is a big market, Africa, Asia are big markets, but right now we're in Canada. It's just easier to sell close to home. Canada, US, and then from there we can take our success and leverage it in the next market.
Right.
You're also an investor-dependent company, right?
Mm-hmm.
So and also a startup. So you first work your backyard, and prove in your backyard, bring the revenues in. Once you got the revenues in, you've got the capital to expand.
Yeah.
And then comes step by step, you get to different territories. So the challenges are many and will always be there.
Yeah, absolutely.
Our job is to just jump over the hoops.
Sounds good. And then, so we covered the regulatory challenges and market entry. Let's talk about, I think we already covered gamification in this, but Laurentian, would you like to say something about some challenges that you had to face, or I think you already discussed about that. So in various types of game, which one is most trending and most popular, and how that integration part of integrating the game with the MyHand.
So I think my favorite one, at least that I've seen the most popular with our patients, is Gem Smasher. So that was the first one that I got to design myself. Because before that we were doing it where I was supervised by a Laurentian student, and she came up with all the designs, and then I just implemented them. So this was the first one that I got to do.
So was it inspired by an existing game that
pinball? So it was basically just pinball, but it was made so that way it was tailored to a specific function that the MyHand system would accommodate. Because if you think of it on a technical level, the only inputs that I have is 5 fingers, right? And I have 5 linear movements. I only have, let's say, a value that ranges from 0 to 10, and I have to play with that as the inputs. I don't have a controller with a bunch of different mappings that have a whole bunch of different ways that you can interact with them, like a short press or a pull or anything like that. And I also have to accommodate for the fact that you cannot some people might not have all fingers available to them, or maybe they just want to focus on, let's say, index or middle specifically, stuff like that. So anyway, in Gem Smasher, I think the reason it's as popular as it is because when they launch it, there's a bit of unpredictability, and let's say they go into the normal regimented exercise program. They're just moving something up and down, moving their finger 1,000 times over and over and over. It might get a little boring after a certain period, but in this case, at least, every time they pull, there's a different outcome. So there's a little bit of unpredictability, keeps things fresh, keeps things interesting, and they don't know what's going to come of it. And maybe they'll get a bigger reward, maybe they'll get a lesser one, but at least they're always chasing for it.
Okay.
Yeah.
Unpredictability is good.
Yeah.
To health, right?
With the games, though, one thing to consider is like we said, like there's different personalities, different individuals using them. So one game that might be a hit for one person, it's completely the opposite. Like someone doesn't like unpredictability. Like someone just likes, if I do like this, I'm gonna get this reward. If I go like that, so that can be frustrating for some. But I think that's what's been really cool with the different games, is that you have a game for everyone. You have a game for someone who has less mobility in their hands. You have someone that's more engaging, someone who likes a lot of things happening at the same time. Others don't like that. So that's what's been really cool, to test the different games and the different platforms that the MyHand system has.
Yeah. I spoke a bit too about how the regimented exercise is not as engaging as our games currently, but that's what I've been learning recently is gamification doesn't stop at games. Gamification is to make other parts of our system more engaging. So right now, what you're seeing is these bar graphs that are moving with your finger in the regimented exercise that move up and down. They might not necessarily see why they're doing it. So they're going up and down, going, oh, okay, well, I just moved my index like 10 times. Is it actually doing anything? Am I getting better? The short-term solution that we came up with was to put dumbbells on the end of each of those little finger bars to drive home the point that you're doing an exercise, and you will get better over time. You just have to do it more. And in future plans, it's difficult, right? In future plans, what I want to do is use my 3D model of a hand that comes up on the screen in various different places in the app. Use that to replace the 2D bar graphs that we're using, and actually show an object of the item that they're trying to, or the grasp that they're trying to train for. Okay. So let's say one of our protocols, our regimented exercise, is to hold a plate. On the screen, you should see the hand model actually holding a plate. Okay. Or if it's for a tennis ball or something like that, or squeezing a ball, you should actually see the ball compress.
So that they can get the feel of, they're squeezing
exactly.
it.
Exactly.
We have resistance that goes against the fingers, and we can change that at any time, depending on the section that they're on in that exercise. So we can always make it look like, hey, it is actually tough for you to get that squeeze.
Right. Yeah, and I think those psychological things does affect a lot, because I was watching a video. I'm pretty sure all of you might have seen that there was a partition where there was one real hand and then there was a fake hand, and somebody's trying to hit the fake hand with the hammer, and the person actually feels as if it is going to hit his hand. So I think those emotions, those visuals does affect our brain and different parts of the body. So
yeah, to make it intuitive, I really gotta give big kudos to Laurentian and the clinicians that worked with them and the patients who participated. Right, we've got a 6-year-old, a 7-year-old kid, to someone who's like 85-year-old, and they're all giving different feedback. So from their perspective, they're giving this feedback. From a programmer perspective, he has to take all of these diverse opinions and then trying to amalgamate that and understand what that is meaningful for a patient from a clinical perspective, and also cognizant of the fact that what the clinicians want. So you see how it's not just, I think that's the point Laurentian was pointing out. It's bigger. Gamification doesn't stop with making a game.
Right.
The package is taken leadership over and created, it's just spectacular.
It has to be meaningful to pretty much everyone who's using it in
Right.
one way or another.
Right on. Would anybody like to share any success stories that impacted any specific user? Maybe Margot, you want to?
Yeah, I can speak on that, but I'm sure that every single one of us in who's worked with any of the patients has one particular story that has touched them. I have many to pick from, but I think what I can really speak on is more like seeing that they've seen an impact, not just on their hands, but like talking about how they feel better.
Mm-hmm.
So whether it's they only gained a little bit, but they're able to live at ease, or they're able to do their day-to-day life. Someone said they're able to dance longer when they're dancing with their partner. So like just leading the dance, for example, that just the feeling of what it restores, like you said, dignity, that's what matters, because I might be able to see a difference in their hand, but like the fact that it impacts their whole lives, that's bigger for me.
Right.
I don't think we can add anything to that.
Yeah.
I just want to add one aspect to that impact. A lot of times when you think of hand rehab, we think of hands getting independent. Think of it from a different angle. We've got a 7-year-old person who's been working with us. Let's say the life expectancy of an individual.
As a patient?
Yeah. Who's had a cerebral palsy and has some the entire hand is paralyzed, right? Now, the impact you make is not just improvement in hand function. Now, you've changed the course of their life for the rest of their lives. Let's say this kid goes on to live 80 or 100 years. You made impact for the next 70 to 90 years. That is the priceless gift that each of us receive, that satisfaction.
Right.
That's what this team has created. I keep using the word team because it's hard for any one person to make these kind of things happen.
Right.
You want an entire team focused, motivated at taking the dream. Because a lot of people focus on a founder's dreams. They forget that founder dream is just one person's dream. It's nothing without that team. When the whole team starts dreaming the exact same dream, they create magic.
Right.
And that's the power of success. And like Marco was pointing out, a lot of individual cases you could talk about, but that kind of takes away the essence, because each impact is very unique.
Right. Yeah. This was very impactful. Let's move on to the future developments and AI integration. Every company nowadays, wants to find ways to integrate AI in their products, whether it is data analysis or programming or any hardware that they are building. They do want to use AI in some way, or they are at least thinking of maybe using this because that's the booming thing. Is there any thoughts you guys might want to share where possibly using AI integration in future, or does it even help, or is it relatable?
So I think the big thing for us first off is the fact that we can't use it yet in our current device, because it's not until we qualify for class 2 medical devices that we're allowed to integrate artificial intelligence into it. But down the line, when that does happen, the biggest benefit that I see from it is predictive analysis. So predictive analysis would let us look at all the data of a particular patient and say, okay, well, this is the rate that you're progressing at and the rate that you're improving. We predict that if you do this specific regimen, or if you spend this much time daily, weekly, whatever the rate may be, that you'll get better and you'll be able to gain this amount of function.
I just want to add like a little bit into that question. Maybe AI integration. There is also a sense of data-driven decisions. Like it's great that there are games and there are rewards, and I'm pretty sure like there will be a user model as well where every patient has their records and everything. Over the period of time, as more people start using this product and more data gets collected, do you see right now, today, or maybe in future? Any sense of the data-driven decisions that might help, or is it currently helping?
So what we're working on right now is building that foundation for all that data to be coming in, and for us to be able to see it to then in the future when we do hit class 2, to be able to use an AI to make those kind of predictive analysis, or not just for the patient's benefit, but also to make our games more engaging, see which games they're playing most, see which ones are bringing the most success out of people, stuff like that.
Right, but I really hope like the data is there, important. Like, do you guys want to add anything?
I think Eric wants to answer.
Eric, yeah, sure.
Data is everything for us.
No, go ahead, Vinny.
So you keep using the word data, and you keep using the word AI. Yeah, everybody's got a buzz around it. Think of it not like AI, but maybe it's kind of looking at that aspects. But what we are really interested in is, a clinician works with a patient. They should be able to diagnose better. So they should get as much data as possible. So that diagnosis is way more accurate. Right? In the current model, all stroke patients are called mild, moderate, severe. What if someone is 32% and somebody else is affected 36%?
Right.
Suddenly one is mild, one is moderate, but they're actually pretty close to each other. The clinician should be able to cater to that individual patient's needs. So that diagnostic ability changes things. Prognostic is the predictive side of things. Like, okay, this is where you are. If you do this therapy for 6 months, here's what you can achieve. Or a range, 5 to 6 months. For this to work, you should do, 3 times a day or 10 minutes each. They should be able to give the patient some level of guidance. What is the requirement? So that's a clinician side. A patient side, a patient would want to know, how many hours do I do a day? Maybe I want to do 15 minutes a day, which means how long will it take? They should be able to understand what it is that they're getting into, right? Not just randomly buying something and doing something. And also, what the AI can do is ask them, let's say one day you're excited and you're gaining more. The AI will allow integration much better, giving them indications on how faster they can go.
Right. And how well did they?
Yeah. Then so we covered two groups of stakeholders here. The clinician and the patient. The insurance or the government provider, they are interested in, should we actually fund these things? So more data we get, that data they look at the data and they go, okay, based on the past, these guys have worked with this many patients got better. And so there's an advantage for the insurance company. So think of disability insurance. Let's say someone after a stroke lives 10 years or 15 years or whatever. They have to pay disability insurance for that long.
Right.
Now, if that individual is able to gain some level of independence, then the insurance company has a lot to gain. So they're also looking at the data. So data is key. I'd rather not use the word AI because everybody's using it.
Yeah.
What we really mean is this.
It has to be
centralized, very, very personalized
Right.
precision medicine, like Eric was pointing out to the patient. Diagnostic, prognostic details to the clinician, and data to the insurance companies.
Right.
I have to leave in 5 minutes. Just a heads up. I gotta leave in 5.
Okay.
Okay.
What time's that?
15.
Oh, okay.
Like, do you want to add, like, we are just going to cover only mission, vision, and
No.
last thing?
We're good.
On
we're
AI,
good.
you're
Just
good?
letting Vineet know so we can
Okay.
get to the last point.
So the last two things that we want to cover is just mission and vision. So I think probably took it from the website that you guys have the mission to help 100 million stroke survivors regain hand functions, and like, how do you envision scaling your impact globally?
I want to make the answer very short, curt, and simple. There are about 15 million people that get a stroke globally each year.
Each year? Oh, okay.
And 10 times that number of people live with a disability from stroke. So it's a really large number. Our objective is to reach as many people as possible. But instead of going into statements and words and mission and vision, let me put it this way. Every single patient that gets better and we see them get better, it brings a tear to each and every one of our eyes. We just want to see a lot of those tears. The more tears we see on a global scale, the greater our mission and vision is attained. And that's why we are called iRegained. Every clinician, every patient, everyone, every stakeholder should have that ability. That's what we call iRegained.
That's great, and I really wish you guys expand all over the world and reach out to as many patients as you can. The last thing that would like to cover is if you would like to speak about any challenges in you see that people when they are trying to adopt this, like what are the challenges that you see that many people they're hesitant or
Yeah, so a lot of the times the challenges revolved around a willingness not to change, or unwillingness to change. So people are satisfied with what they're getting right now, and they shouldn't be. Right now there's a big focus on functional recovery, which is excellent, but we have a technology, and there are other technologies in the space that follow on restitution to function. So not just adapting to what your environment is or what your condition is now, but actually restoring the lost function that you once had. And that's something that we offer, is the ability to restore function to a certain degree. And a lot of times there are various stakeholders in the healthcare system, whether it's insurers or boards of people who are possibly buying the device, who just don't want to change from the status quo and are satisfied. And that's where we need our clinical champions, so the clinicians and the doctors, the physiatrists, who are on board and who advocate for better care. They know that technology can have an impact on the care that they deliver to their patients, and they are looking for solutions actively to improve the care of their patients. So we have doctors all over the US, Canada, we have clinicians that advocate for systems like ours that are technologically advanced, innovative, and have proven results, and that show that they are better than the status quo and that people deserve better than what they get right now.
Amazing. Thank you so much. I think that concludes our podcast. Thank you so much, guys. It was great having this discussion with you guys, and I think we can just stop.
Thanks for having us.
Sure.
Thank you, Mihir. It was a